So, good morning, everyone. So, this is the point my previous speaker explained all. So, it will be easier for me to highlight all those points. I will skip all those theoretical points. It's not moving. Slide is not moving. Okay, okay. I have no financial relationship. I will skip all those points to save the time. So, in Rajiv Brahman is working in a big institute, and to address all ophthalmologists, all paramedical staff, is it possible to do it telemedicine to each and every corner? Right now, in our AIOS Kumbh Mela, they are doing so many works in remote areas. Natarajan sir mentioned how we can carry a small scale device in without any damage. So earlier that cost cutting technology also is a teleophthalmology, we can be a cost cutting. Some simple mobile is a good quality in everyone's hand, so we can use it instead of a big mobile van. It's not possible to use in every village because we need a road connectivity also, and big setup is the only issues. Like that, this is my motto is that earlier in in our computer big chip, big one, but now is a very small micro. Everything is with the nanotechnology. My previous speaker mentioned poor quality of photograph. What? Yes, this mobile from they're sending me this patient by poor quality, but he was complaining of epiphora that that paramedical that one probably thought it may need DCT or DCR, but I just asked from the symptoms and the same day photograph. There's a facial pulse. Asked immediately to check the pressure, and he was very much hypertensive. So we can save so many life on that way also. That boy, they are treated somewhere by say, simple inflammation. I asked the parents to send that one photograph and then few slips. It is a that type of inflammation, and I asked that for a CBC. He was found blood malignancy. That a COVID time. So we can do so many things. That's my earlier I did a sim observation. Everyone mentioned so maximum from rural population still. It can be also by a mobile. You can teach my resident, teach my previous fellow who are working in remote areas. So dog bite, he forgot how what to do. So from that, he is asking me, so we can communicate each others to on the group. So those are the things you can avail. Is it available or not? That drug, how we can, what are the process to do the repair, etc. Every point. So you just take a clear photo. Previous photo was not clear. Next year sending the clear photo. One patient. It's a retinoblastoma. It was operated in some other Nepal or somewhere. The parents wants to during COVID time, so they are informed me. So there is some swelling. Then this is one of the disadvantages I am selling. So for telemedicine, from the looking is not possible. Then I asked to come. Moment I examined, that found CT shows that the ball was migrated to the upper part. So in some cases, there may be some negative results, but we can do. So just recently I want to show one of my patients. Yesterday I was delivering a talk, then there is some WhatsApp message over one of my paramedical water from my hospital. She told, this is the photograph. Can you see that is one-eyed patient? From this, I can say, so now what to do, I just advise everything. So on Monday, I will operate that thing. So that's the point we can do. So the small scale device also works, especially like in India, where there's a huge number of population. It's not possible. Doctor population ratio is very, very thing. And a big setup is a lots of infrastructure. Fund is one of the issue. And there is so many factors. So by a mobile or small scale device, if we can tune up, we can do some collaborative studies in such cases, then if that everyone, that's a blessings for us. COVID also one of the point into teleophthalmology, at least for teleophthalmology, because everyone now knows how to operate, how to send the documents. So it is enough. So this is one of the patient with the communication with the pediatrician. Even in the, I was working in a tertiary care hospital at present. So there's a road traffic accident. The ambulance critical care team and the driver send me this photograph, then I can understand what we should do. And immediately we can arrange whole team, critical care team was arranged, and next we are doing, we can save the life also. Not only the diagnosis, sometimes we can save the life, we can test, everyone is tuned with this device. From the business perspective point of view, to improve our practice, we can use it very, very handily. So those are the points I can just communication. Follow-up can be done. So some patient wants to follow up instead of, so is a business impact. Suppose there's a 3-4 employees, you can cut short, just they can ask them to mobile WhatsApp. Instead of by phone call, just I always advise all my patients to my secretary or to me directly by WhatsApp. So that's a one way to we can cut short so many points, so many things. But there is a few limitations is on previous my speakers, so there's a quality of the picture, especially in case where non-myotic it is a PSOS. Of course, because for a diabetic retinopathy, it's not possible for dilate each and every patient. The technician is not, for them is not possible to be a gonio because India is a prone for a angle closure glaucoma. For that point, of course, a poor quality. And especially in case of a glaucoma and in optic nerve
please
disease.
conclude, please conclude.
Yes, sir.
Yeah. Dr. Inder Rastogi.
So just I want to conclude, it is a small scale also works very good. Thank you, sir.